Hello everybody. In this video we will start part 2 of our course of Bach therapy. In previous videos we have spoken about technical aspects of the therapy and of the essences mainly, and we have described the essences in detail. However, this information isn't sufficient for the treatment of more complex or chronic cases. Why? The problem is that Bach essences aren't like classical medicines. First of all, let's explain the difference between classical medicines and medical instruments, like, for example, scalpel. Medicines work independently of the therapist. They have an action of its own. So, for example, even a layperson can use antibiotics without the help of the therapist, and the effect is often beneficial. On the other hand, no layperson can use a scalpel. Nobody can do an operation on himself. He needs a skillful surgeon, and only then he can expect a success. And Bach essences stand somewhere in between. They have some aspects similar to classical medicines, and in some aspects it's similar to surgical instruments. What is necessary for a successful operation? First of all, in most cases we need patient's agreement and informed consent of the patient. Then we should choose the right moment, because while in some moment the therapy will be useful and successful, in another moment it can be even dangerous. We need to do some preoperative preparation. We must choose the correct place and direction of the incision, and postoperative care is necessary to prevent complications. We can demonstrate the importance of preoperative, so-called preoperative care in the following example. It is a story of a 30-year-old woman, Vanessa. She has 2 children and lives with her 3rd husband, and there is a suspicion of home violence. And we can demonstrate the difference of the approach on following 2 dialogues. And finally, I will ask you which of them do you prefer. How are you? I'm fine, but there is a forced smile. There is something incorrect. No, I can see you are not fine. Something is wrong. No, everything is okay. Oh no, the bruise on your arm. Your husband has beaten you again. It was an accident. He did not want to hurt me. No, it wasn't an accident. It's over and over. I tell you, you must leave him, or otherwise he will injure you badly. He is a good man. Only when he has a lot of work he needs to let the tension go. He drinks alcohol and sometimes he hits me, but he has promised me that he will not drink anymore. In my experience, such men will never change, and they certainly won't change because of you. Believe me, I know him. He feels always very guilty next day and apologizes many times. It's a typical story of abused women. The husband beats them, then he promises he will be good, and then he beats them again. And this beating will be still worse. By the way, what about the children? They aren't his, are they? Does he beat them too? Oh no, he is nice to them. Only once, when my son was a little bit noisy and my husband had a headache, he slapped him, but normally he does not beat him. So, he has already beaten your son. If you are a responsible mother, loving your children, you will leave him. Otherwise, there is a risk that he can hurt them. And let's demonstrate the dialogue B. How are you? Forced smile. I'm fine. Everything is absolutely okay. Yes, most things are okay. There are things that are okay and things that aren't. After a hesitation and with a trembling voice, yesterday I had a quarrel with my husband. You do not like conflicts. No, I do not like quarrels, and they are more and more frequent. It's already too much for you. He is a good man, but sometimes he gets angry. He is a good man and he sometimes beats you. Hmm. I sometimes even hesitate whether to leave him or not. Your feelings fluctuate. Sometimes you feel attracted to him and sometimes you have a fear of him. Not fear. Oh, maybe yes, a little bit. You know, the children are only mine. They have another dad. And he sometimes gets angry at them. He has even once slapped my son. Little George did not understand why and began to cry. You are a good mother and cannot look at your children crying. If he beat only me, it would be okay, I sometimes provoke him, but when he beats children, I feel terribly. You are really worried that he can hurt them. I would already leave him, but you know he is my third husband. Previous husbands were violent too, and I'm afraid that the next man I will find will be the same. So, the question is, which of these dialogues do you prefer, A or B? If you prefer dialogue A, so probably the next videos will be neither useful nor interesting for you. However, if you prefer the dialogue B, the following videos will give you some tips how to improve the relationship and how to motivate the patient for a change. As for the dialogue A, the communication is disharmonious. Instead of using her resources to find the solution, she spends her energy defending her husband. So there is a conflict between the therapist and the patient. And the therapist doesn't believe that she is able to do the right decision by herself and tries to push Vanessa to leave her husband. So their goals are different. While the patient either doesn't want to change anything or asks for something to help her to bear the difficult relationship more easily, like being not so nervous or tense or something for calming down to reduce her fear, for example. The therapist wants to push her or force her to leave the relationship, to leave the husband. And such therapy cannot work. On the other hand, in Dialog B, the communication is smooth and the therapist respects the patient's autonomy and the patient admits that there are problems if when she isn't pushed she is able to recognize that there is some problem and that this problem needs to be solved. And it's quite possible that they will find a common goals for the therapy, like to reduce oversensitivity and fear of conflicts, or help her to learn from her experience more easily, because there is some repetitive pattern. She has 3 husbands. She has already had 2 husbands before, and they were violent, and the present husband is also violent. So there is something repeating. These every sentence of this dialogue B is based on a method called motivational interviewing. Every sentence represents one of the techniques. And all these techniques are used to improve the therapeutic relationship and to motivate the patient for change. This method was originally developed for the work with alcoholics and drug abusers, and you probably can imagine yourself that the work with such patients isn't easy, because they are often sent to the therapy by the court, for example. So they do not want to come and do not think there is any problem they need to treat. And this method proved really efficient, so efficient that it started to be used in various branches of human activities. For example, in psychotherapy, in schools, teaching, education, in social work, even in prisons or by priests. Because in every branch of human activity, a good communication with the client, patient, customer is necessary. So in the next videos we will speak about the principles of Bach flower therapy that lie behind every therapy, and we aren't often aware that something like that is going there, but it influences very importantly the result of the therapy. And then we will continue and we will explain the techniques you have seen in the Dialog B, so you will understand them and you will be able to use them in your own practice. We will explain the process of so-called therapeutic dialogue that is the core of Bach flower therapy. And finally, I will offer you some hints for a good practice, even for beginners. So, thank you very much for watching this video. I hope you have enjoyed it. And in the next video we will speak about the principles of Bach flower therapy.